Good morning, MBG family, and thank you so much for being with us on this Monday morning. We are here to talk about everybody's favorite subject, health insurance, with our friends at Aetna, our associate members as well. We know here at the MBG that healthcare costs are number one pain point for so many of our members, and many can't offer health insurance at all, either given the price point or the number of employees that they have. But Aetna has a creative solution and some unique benefits that are specific to MBG members that we're here to discuss today. If you have any questions throughout the session, you can type them into the chat or raise your hand, and I'll flag Chris to get those answered for you. So without further ado, I'll turn it over to our experts at Aetna. Chris Ritchie, take it away.
Thanks, Katie. And thanks for everyone jumping on. Like Katie said, if you have questions, feel free to jump in. We will wait till the end. And we are recording this so that if you don't get a chance to stay on for the full time, you can reference it back later. Okay, so let's see here. Aetna, several years back, Aetna, about 10 plus years ago, started to look at what we offer for medical insurance and try to come up with a better solution for our small group customers. So that's people that have under 100 employees enrolled. And we rolled out a program called Aetna Funding Advantage. It's been very successful over the years. And through our partnership with the Mass Brewers Guild, we've got some particular specific benefits that we find that are advantageous to breweries and associate partners. We're going to walk through those today. It's only about 20, 25 minutes or so. Like I said, feel free to jump in with questions or wait till the end. And we're certainly happy to have you follow up. I will have contact information at the end if you want to do a deeper dive. Okay, so Aetna Funding Advantage, again, this is employer-sponsored medical insurance, so not individual insurance. This is something that you as an employer are offering. Who's eligible for it? It's employers with 2 to 100 enrolled, so we do go down to the smaller size groups. Participation minimum. So for any size group, you would have to have at least 30% of your full-time eligible employees enrolling in the plan. And that's because we want to make sure we're getting enough on the plan to make it worth your while. We know sometimes the higher costs of insurance make it hard to get people to sign up, but we think with this program having much lower cost to it, this will help you get more people to jump on the plan, make sure more of your employees are covered and well taken care of so that they can be happy, healthy, and obviously more productive at work. What is available to Mass Brewer Guild members through AFA? Lower cost plans with comprehensive coverage. So even though they're lower cost, you're not sacrificing benefits. The ability to offer multiple plans to employees, people particularly like this, even down to a 2-employee group, we allow you to offer 2 plans. We know sometimes not everybody has the same needs. Some might be a single employee, some others might have a family. For groups of 5 plus, we allow you to offer up to 4 plans. And we have a wide range of benefits for as far as copays and deductibles, ranging from a very rich plan where it's a $0 deductible, all the way down to a high cost deductible of $7,500, which keeps your premiums on a monthly level at a much lower rate. All of our plans meet the Mass Credible coverage guidelines for tax purposes to have a qualified health plan. Okay, so through our partnership the last few years with the Mass Brewers Guild, we've seen great discounts for member organizations. Through the way we price this plan, you can see sometimes savings up to 20%. For Mass Brewers Guild members, there's also a special credit program where signing up for Aetna will give you a one-time $600 per employee admin credit. You can also save on the benefits. There are benefits built into these plans that have $0 copays for the CVS Minute Clinics and for telehealth services. There's an employee assistance program built into the program at no cost. There's also $100 per member per year for over-the-counter health solutions at CVS Health. So there's a lot of additional benefits built into the plans, which we'll talk about. Also, when you get your renewal year over year, for those of you who are offering insurance, the average increase for our brewery customers is below the industry trend. We found that from a utilization perspective, breweries tend to be lower risk, healthier population. So the pricing at the renewal reflects that. Um, Also, on this type of plan, if you basically have lower claims than expected, you have the ability to get money back at the end of the year. So this is our surplus program, something that's different than what you might be offering now. So again, there's a lot of different ways you save, whether it's the premium on a monthly basis, the benefits being richer for your employees, and then looking at potentially even getting money back if your group does better than expected. So overall, the Aetna small group AFA value, we try to be full service to your employees as far as meeting all their needs. That includes cost savings. Um, it also makes sure that they have access to proper care. Aetna is a national company. We've been around for over 175 years. The networks for providers and access to providers on this are some of the biggest networks available. So it's on a national basis, even though we're talking to Mass Brewers Guild members, Massachusetts fully covered as far as the providers. We do have people who travel or have kids in school in other states. So we're making sure we're giving you the biggest of the net provider networks available. Because we're also owned by CVS, there's pharmacy integration where you're getting your prescriptions at a lower cost. We have member engagement programs to stay on top of chronic conditions and help people find ways to save. And our plan designs and our product is designed to meet your needs as an employer with a very population. We know not everybody has the same needs, so we try to give you options to make sure you're keeping people as happy as possible. I mentioned that we're owned by CVS Health. It doesn't mean you're locked into just using CVS, but it does give you a lot of unique benefits. That includes Aetna. You've got CVS Retail, where there's discounts on CVS items, CVS Pharmacy at a lower cost, CVS Caremark, which is our mail order services, and even the Minute Clinics, which is the in-house provider services that are offered inside of a CVS. So we try to take care of your employees where it matters most. So when they're at home, and obviously people work a lot of hours and a lot of different hours, so they don't always have access to go to the doctor during the day. We provide the ability to get CVS virtual care or virtual primary care. There's also our EAP program or employee assistance program that gives them additional resources, which we will discuss. When they're out in the community or working, people run into issues with minor illnesses. I know I have two kids, things like earaches, pink eye, poison ivy. I've dealt with all those things with my two kids. The ability to go into a Minute Clinic at a $0 copay and get these particular illnesses or injuries dealt with is a tremendous asset, as well as access to in-network walk-in clinics. And then, of course, we've got access to get you to the provider groups that you're used to. Massachusetts, of course, has access to some of the greatest providers in the country. So we're spoiled here. But as far as emergency care, specialty care, primary care, we've got it all covered as far as being in the network. Also, by going to a CVS, you've got two different ways to be able to save yourself more money. Our maintenance choice program, which is for people who are on a maintenance medication, they've got the ability to go in and pick up that medication in person if they don't want to do mail order and get the 90-day supply at a 60-day price. So they're saving 30 days. Again, I mentioned earlier, our over-the-counter solution, which is the OTC Health Solution, gives $25 per quarter to each member on the plan. So that's subscriber and employee and their dependents. So $100 a year to use as a discount off of CVS items. So you can walk in and get $25 worth of CVS brand items at no cost. Again, these are the built-in benefits that your employees will see and feel like they're getting great value in getting their health insurance through Aetna and through their employer. I mentioned earlier, employers of 5+ can offer up to 4 plans. For 2 to 4, you can offer 2 plans. And again, this gives you a lot of flexibility. You're looking at one of the largest networks for providers. We've done a lot of things to help with the cost of prescription drugs through CVS. There's an additional benefit by going through them, although you do have access for standard or prescription fills through all retail pharmacies. And then again, our benefits within the plan give you a lot of flexibility to find what works best for your employees. So quickly, I touched on it. Um, Access for members. One of the most important things when people are looking at switching insurance is, do you have my provider? Am I going to be able to see who I want on your plan? And again, the answer with us is absolutely yes. Again, we're one of the biggest insurance companies in the country. We've been offering coverage for over 100 years. Our access to providers is unprecedented. And what's good is we have the Aetna Smart Compare tool. It's very hard to find a new primary care. A lot of people have retired over the last few years. So we do have online medical assistance as well for online primary care or online just even teledoc services. On top of that, we do have a pretty unique tool here with Aetna Smart Compare that allows you to find the right providers. So this is something we've rolled out just recently as far as online tools for our members. We try to make access as easy as possible. I know Katie and I were talking before we started. A lot of people don't really understand insurance unless they need to use it. So we want to make sure when the moment comes that it's important to you and your family, you have access to the right tools to get you to the right providers. Again, coast to coast coverage, over 285,000 primary care doctors, coverage locally. Absolutely. All the mass hospitals are covered in network. And you do with this plan even have out of care coverage. So, what are some of the additional financial incentives for you as a Mass Brewers Guild member? We rolled out a credit. So, essentially, when you move over to us, we're giving an incentive of a $600 per subscriber. So, anyone who enrolls, so that's the employee. So, you're going to get an additional one time payout of $600 per employee. So 10 life group, 10 people enroll. It's a $6,000 credit that goes onto your bill. And I'm sure we could all use a little bit of extra money to make health insurance more affordable. Also, if you were to bundle medical with dental, we have medical and dental bundle, an additional $150 per employee as an admin credit. And that runs right now through the end of the year. So this is one of the things, we've found that breweries tend to have healthier employees, believe it or not. And because of our partnership with the Brewers Guild, we wanted to be able to do something extra to help the brewers have additional funds to make health insurance either more affordable, or for some of you smaller groups that don't offer it right now, this might just be the extra kick that helps you kick things off and roll out a plan for your employees. Okay, I mentioned before the minute clinics. If you're on a non-HSA compliant plan, you're basically getting your minute clinic services covered at a $0 cost. So again, the things like pink eye, ear infections, poison ivy, those are things that you can go into the in-house provider services within the CVS and get at no cost. Those are things that sometimes you don't have time to get to the pediatrician or to your primary care, or they don't have an appointment for another day and a half. Minute clinics, you have the ability to book your appointments online and know exactly when it works for you. And they have extended hours as well. Over-the-counter health solutions, I talked about it a couple times. Here's a nice example of it. So a member goes in, they want to get a digital thermometer and some nasal decongestant, sore throat spray, $25 worth of cost. Maria's daughter here, Sophia, has the flu, and her mother's able to go in, get this for her daughter. And when she goes up to the register, they are going to ring this up at zero cost. They just need to see her Aetna ID card and confirm her date of birth. You do have to go to a live cashier. I know I tend to avoid the self-checkout anyway, but you can't do the self-checkout to get the credit. You do also have access to CVS items with this $25 per quarter discount online, or you can also offer things over the phone. I mentioned earlier, for people that work different hours, maybe you work a little bit more during the day, or maybe you just don't have time to get to a provider. We do have virtual primary care. especially for people who can't find a provider, or as it says here, primary care appointments. Sometimes it takes 5 days to get an appointment, or for a mental health provider. We do have on demand primary care access, as well as virtual care for illnesses and mental health issues. So, this is a great benefit for your employees, as well as our EAP program. This is something that's for employees who are on the plan, children up to the age of 26 years old, even if they're not currently at home, so they could be off at college. And for any other household members, even if they're not related to the employee. So anyone living with you has access to our EAP program, our Aetna Resources for Living. And what that includes is a little bit more of the non-medical side of things, the things that, a lot of people have weighing on their shoulders that they don't always have time to address. So access to resources to help you with things like childcare, pet care, elder care, legal consultations for credit issues, for divorce. So there's lots of access to resources here. This is something that's built into the plan. And this is, we think, something that helps address the total of what an employee is going through. Because obviously, we have a lot of employees who may not have medical issues and may be very healthy, but we all know that life comes at you fast and there's always something going on. And we feel like this helps address that. We also look at a lot of specialty chronic conditions, one of them being diabetes, which is something we see pretty much any group that moves to us has people that are on the dealing with the diabetic diagnosis. We have a $0 blood glucose meter program and some preferred diabetic prescriptions that are coming at a lower cost or a zero cost. So we have more information for that, and that's something you could certainly feel comfortable knowing that we're trying to help the people who have chronic conditions stay healthy, stay on top of their condition so that they can be healthier, happier, and more productive at work. So I said I was going to try to keep this brief. What I would tell you is, what are the next steps here? Upcoming our conference that we've got with your folks on November 4th at Jack's Abbey. We will be there in person. We will have a table. As much as we love doing these things online, we are much happier to see you in person and walk you through how the program works. In the meantime, or even after then, I would certainly encourage you to reach out directly to us. My information is the second one here. We've got Joe DeRazio, who loves to attend your events, should be with me there as well. And I am the second one here, Chris Ritchie. Happy to look over what you have for insurance now, work with you on that, and get you some options. A lot of you may work through an insurance broker. Certainly encourage them to reach out to me directly, and I can get them the different pricing and programs that we offer. We will be continuing to support the Brewers Guild at a lot of events in person, and we hope that we can help you find savings and access to care. And for the member groups out there that may not be offering insurance currently, we'd love to be able to help you jumpstart that and make sure you feel like you're offering the most robust benefits package you can to keep your employees happy. So with that, I am going to open it up for questions.
Thank you so much, Chris. That was an excellent overview. We love when our members help to save our members money. So if anyone is feeling brave enough and has had enough coffee to chime in and ask a few questions, we're happy to answer them. Also, we will be circulating this recording through our newsletter and in our closed Facebook group for brewers. So you'll be able to access it anytime or share it with other members of your team to take a look. I'm not seeing anybody chime through, Chris.
That's all right. I mean, again, we always know that insurance isn't the most exciting topic, and most of the time people care more about it when they really have a need to address. Just know that we'll be there when that time comes up. Maybe your renewal for your insurance is mid-year. We're always available to jump on a call like this and talk to you individually as well. And certainly, these programs are meant to just make sure that you're aware that we're here. We're a partner. We're not planning on going anywhere. So we're happy to get some general information out to you. and certainly would love to get an opportunity to talk to you personally, and go through your individual situations and help you out.
Wonderful. Well, thanks again for all this great information today. Thank you to the members who chimed in, and we'll see you on November 4th. We're looking forward to it.
Thank you.
Cheers, everybody.